Acute Methotrexate induced crystal nephropathy. Definition: Methotrexate is a type of antimetabolite and a type of amphibulate that is used to treat many types of cancer. Crystal nephropathy: several medications that are insoluble in human urine are known to precipitate within the renal tubules. Intratubular precipitation of either exogenously administered medications or endogenous crystals can promote chronic and acute kidney injury, termed crystal nephropathy.
The development of diabetic nephropathy involves hypertension and hyperglycemia-induced changes in multiple pathways that contribute to morphological changes in the kidneys. The glomerulus is a globular-shaped structure composed of capillaries that are actively involved in the filtration of fluid from the blood to form urine. With diabetic nephropathy, early glomerular hemodynamic changes include hyperfiltration and hyperperfusion, which result in microalbuminuria. Increased afferent arteriole dilation due to a dysfunction in the vasoconstrictive autoregulatory response contributes to increased intraglomerular pressure, which is associated with greater mesangial cell matrix production. Expansion of the mesangial area, an early morphological change with diabetic nephropathy, is caused by greater extracellular matrix deposition and mesangial cell hypertrophy. This expansion is associated with a decreased glomerular filtration rate and a reduction in the surface area for filtration, which marks the beginning of renal failure. As this process continues, the glomerular basement membrane thickens, and this may eventually lead to glomerulosclerosis. All of these changes in glomerular hemodynamics cause stress and strain on the kidneys, which, if left untreated, may result in renal failure.
Hey, this is Medicos Perfectionalis. Let's talk about urine crystals. So urine crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like, for example, hexagonal shaped stone. It's like cysteine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cysteine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember it, uric acid, sometimes gout comes into mind. And in gout, the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cysteine. Coffin shaped, struvite stones, the evil one. rhomboid-shaped uric acid. I hope it's simple, because it is. Now it is. And please subscribe, give it a like. You can like us on Facebook, follow us on Twitter. You can support these videos on Patreon. I'll be grateful if you do that. But for now, enjoy the day.
Applications in medicine. Methotrexate is used to treat rheumatoid arthritis and severe psoriasis. Stops cells from using folic acid to make DNA and may kill cancer cells. It may also lower the body's immune response.
Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefit, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may have.
Pros and cons. Pros. Methotrexate treats cancer by slowing the growth of cancer cells. Treats psoriasis by slowing the growth of skin cells to stop scales from forming. And may treat rheumatoid arthritis by decreasing the activity of the immune system. The cons. Methotrexate may cause very serious life-threatening side effects and may cause liver damage and lung damage, and damage to the lining of your mouth, stomach, or intestines, and may increase the risk that you will develop lymphoma.
Hi, I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Issue applied in Ecuador. In the Ministry of Public Health, it is recommended to use methotrexate as a first-line drug for treatment of rheumatoid arthritis. The dose should be optimized with rapid increases up to 25 mg per week and associated with the intake of folic acid.
Since the 1940s, methotrexate, known as MTX, has been used as an antimetabolite to block cell proliferation in neoplastic diseases. While the rationale for using MTX to treat rheumatoid arthritis was presented in 1951, it took another 30 years before the results of well-designed, placebo-controlled studies were available. Interestingly, the precise mechanism for how MTX works in rheumatoid arthritis has not yet been fully elucidated. However, a growing body of evidence suggests the mechanism of action of MTX in rheumatoid arthritis might be its anti-inflammatory effect rather than its anti-proliferative effect. These anti-inflammatory mechanisms may result in clinical effects such as rapid clinical remission, short-term effect on acute phase reactants, and rapid disease flares after discontinuation. Let's take a closer look at how the anti-inflammatory response might occur based on preclinical studies. Extracellular MTX is actively transported into the cell. Intracellular MTX is then polyglutamated, which converts the molecule into its active form. MTX glue inhibits a variety of different folate-dependent enzymes, but ACAR transformylase is the enzyme it inhibits most effectively. Polyglutamated MTX inhibits the enzyme ACAR transformylase. Because ACAR transformylase activity is blocked by MTX glue, ACAR molecules can no longer be broken down. The result is an accumulation of ACAR within the cell. With an increase in ACAR within the cell, the levels of adenosine also begin to rise. Adenosine is an important molecule that has an anti-inflammatory effect. As adenosine accumulates within the cell, it is released into the extracellular space by exiting through the cell membrane. Extracellular adenosine is available to then bind to any of the 7-pass transmembrane adenosine cell surface receptor types, including A1, A2 alpha, A2 beta, and A3. These are found on the surface of a wide variety of different cell types. Adenosine binding to cell surface receptors helps regulate the inflammatory response by inhibiting the production of several key pro-inflammatory cytokines. As the level of pro-inflammatory cytokines lessens, the inflammatory response is also reduced. Although the full mechanism of MTX in rheumatoid arthritis is not completely understood, adenosine accumulation and release are thought to play a major role in its anti-inflammatory properties. The adenosine-mediated anti-inflammatory effect of low-dose MTX is well supported by in vitro, in vivo, and clinical data.
Conclusion. Methotrexate may cause serious side effects, and you should only take methotrexate to treat cancer or certain other conditions that are very severe and that cannot be treated with other medications. Thank you.